Jeffrey, what are the new developments in AI that we can talk about?
Well, there's a lot going on right now, Michael. One of the things that we've been focused on for the past year is using an AI scribe tool called DAX Copilot, and it captures the physician documentation for a visit with a patient without the doctor having to type anything. So it's just a matter of taking the conversation with the patient, and then it uses generative AI to summarize that in a standard medical template that doctors can use in the EPR. And we began this back last summer in June, and started with 120 physicians, and now we've got about 300 people using it and are looking forward to an expansion of this in the next year.
So that does sound like a revolution. How is it being received, embraced by the workforce?
Well, about 75% of our users have found it hugely beneficial. Not everyone continues to use it, but for some people it's been transformative. I mean, the reason we're doing this is because physician burnout is a big deal in the United States, and I think everywhere in the world. And so we're trying to use technology to lessen some of those administrative burdens, those tasks that physicians don't like to do, so they can focus on taking care of their patients. And this is just one of the strategies that we've been pursuing.
So you've been talking to quite a few people here from the healthcare sector at DMEA in Berlin. You think that these approaches will be transportable over to, for example, Germany?
Yes, I think so. I mean, this is narrative text, and we all use that in caring for patients, both in summarizing the story as well as in our assessment and plan. So if you generate a letter for your referring physician, it's all captured with this. And so I think it's the same activities. Doctors all over the world talk to their patients, summarize the story, make plans to care for their patient, and that's what this tool is intended to support, regardless of the EPR or the system that you're working in.
So this is brand new, but taking into perspective what could come after it, what do you think further developments could be?
Well, so we're looking at other types of AI as well, but I think with this in particular, the next step that we're working with Nuance and Microsoft to further develop is teasing out of the narrative orders. So if I say to the patient, I'm going to order a scan, or I'm going to refer you to a specialist, or I'm going to prescribe an antibiotic, the DAX Copilot tool is now pulling those orders out as discrete, orderable topics. So then you can drop that straight into your EPR and it will execute the order. That's the next step. Likewise, we're anticipating that if I say to the patient, you have viral meningitis, that it should then be able to tee up that diagnosis for me in a structured way in the EPR, and then support clinical decision making by, showing the doctor recommendations for treating this disease or other considerations with the differential diagnosis, that sort of thing. So I think that's the next development of this particular ambient generative AI, where the things that I say to the patient then trigger supporting actions in the EPR for this physician.